Joining me now is Dr. Jitendra Singh, Union Minister of State, Independent Charge for Science and Technology. Welcome, sir.
Thank you. Thank you.
So let me begin by asking you about your experience at the Times Now Doctors Day Conclave today.
I think at the outset I owe to compliment Times Now for having organized such a beautiful ceremony. More so because medical professionals rarely get to find a media slot in the mainstream media, unless a pandemic like COVID happens.
Of course.
So to that extent, I think it's a very great initiative to have some of those who have actually not only made a name for themselves, but also gone a long way in serving the society. At the same time, it was also a personal gratification of sorts that under the same roof you could find medical specialists who have distinguished themselves in different streams, different areas of work across the country, and then to 3 generations of them. A generation ahead of us, a generation our contemporaries, and the generation next. So I think tremendous amount of exercise and diligent work must have undergone in organizing an event like this, and I'm sure as we move on, this will further evolve, and I must compliment Times Now for that.
Thank you so much. That's actually very generous of you to say that. Okay, let me start by asking, technology and AI plays a very important role in, every industry, everywhere you see technology has evolved a lot. So, what do you think? What role is technology playing in, the medical sphere?
No, absolutely. Actually, the medical practice was never devoid of technology, but it's becoming increasingly more technology driven as we move on. It's not only progressively increasing, but the pace at which the technology is taking over also is moving very fast. And as you rightly mentioned, artificial intelligence is going to take up a role in a way, in a scale bigger than we can envisage today. But what is heartening is that India today is at par with any other nation of the world.
Absolutely.
Which was not so maybe till a few decades ago. And I think one of the easiest examples for your common viewers I can cite is that, for example, the television happened in the United States way back in 1950s. And the famous presidential debate in which John Kennedy turned the tables on Richard Nixon in 1960 was a television debate, as you are having these days also between Biden and Trump.
Right.
But at that point in time, in 1960, we in India hardly knew what television is all about and what TV debates are all about. But today, we are at the same level as any other nation. For example, our quantum mission. We are among 5 or 6 nations in the world who are into quantum research and work, which is greatly or hugely going to transform even our medical practice, both in terms of diagnostics, also in terms of therapeutics, there's tumors otherwise. Similarly, if you go for, take the example of space, I mean, though that's not strictly related to medicine, ISRO, the organization was set up in 1969, and that was the year when America landed its first human being, Neil Armstrong, on the surface of the moon.
Yes.
But today we have landed on the south pole of the moon ahead of all others. So now, not only that we are at par with other nations, we are also in a position to offer cues to them. In more ways than one. Now, as far as the medical practice is concerned, we are among the top biomanufacturers in cost-effective instruments. As far as our biomanufacturing is concerned, we I think around 11 or 12 in the world, and the India Pacific we are just about third, ranked third. And we are the biggest producers of vaccines, because the future is going to be the preventive medicine. We were the one who came out with the first ever DNA vaccine and also provided to the other countries of the world. So to that extent, I think that's because of the prioritization given by the present government headed by Prime Minister Modi to the health sector, to also research and development, to all the science streams. And since we are expected to talk in terms of figures, evidence and statistics, I think you would bear me out that in 2014, our bioeconomy was just about $10 billion US, which in 8 years went up to about 80 billion. Today we are about 130, 150 billion dollars. So, whereas our startups went up from 350 to about 1.5 lakh, we are ranked third in the world. Our bio startups or biotech startups were hardly 50, 2014. So, and that integration which is now there, the biotechnology, biomanufacturing, we are going to have a dedicated program on biomanufacturing very soon. And we have already initiated a global biopharma forum which happened during the G20 meeting.
Right.
So not only we are contributing hugely to the futuristic aspects of therapeutic and preventive healthcare, we are also offering important inputs to the rest of the world. So I think that's what has made difference over the last few years.
And I think it's commendable, the work that you're doing. It's really great. Okay, now, talking about, since you've already mentioned about technology, one thing that I want you to maybe, talk to us about is the initiatives by NHA. They've been digitizing the entire healthcare. So if you could just maybe talk about their initiatives or what they're doing on, digitizing the entire healthcare ecosystem.
I think you would recall that it was none less than the Prime Minister who in his one of his Independence Day addresses spoke about digital health from the ramparts of the Red Fort. And an Independence Day address of any Prime Minister is expected to be said to be the declaration of intent of the government in place. So that was a clear shift of prioritization by the political dispensary. And what we must understand is that we never had a dearth of human resource.
Right.
We never lagged in human talent or human acumen or human commitment. We were equal to any other nation of the world, even better. I think nothing better spells out that than space, because when we started the space program, Sarabhai used to carry his baggage on the carrier of a bicycle. That was the dearth of. So what we were lacking is an enabling milieu which is to be provided by the policy planners, by the political dispensation. So that has happened now. And that's why I'm saying we are not now lagging behind any other country. So digital health in more ways than one is going to transform the entire approach.
Right.
Not only in the terms of maintaining the data of individual patients, but also in the terms of reaching out to the patients, providing them the health care at the right time, the optimum time. So we have started moving in the right direction. And since it's an evolving area, as you mentioned, the artificial intelligence also is now, it's intervening at different levels in more ways than one. And it's going to be a learning experience as we move on with it.
Absolutely.
So I think what is heartening is that the world now acknowledges that we are on the right course.
Right, of course we are. Okay, one last question I want to ask is, how important do you think is empathy in the medical field?
No, absolutely. I think there's no substitute for that. But I think regardless of what the different opinions happen in the society, by and large you would realize most of the successful medical practitioners have a good amount of empathy as an attribute. Otherwise, a practitioner does not succeed as a practitioner, because at the end of the day, it's how he deals with his patient. Regardless of the fact that now we have so much of technology available that you could carry out a surgery on 10 patients without having to see the face of the patient. But nevertheless, at the end of the day, it does make a difference. And not only from the point of view of an idealistic or a human approach, I'm saying, even from a professional approach, it's always useful for a medical professional. I think sooner or later, every successful medical professional also learns to that.
Right. Anything else you would like to say to our audience?
No, I think in the times to come, if you see from the national perspective also, more than 70% of our population is below the age of 40. And the challenge that India is going to face, as Prime Minister keeps talking of 2047, the next 20 years, is the prevention of some of those morbidities which have now started affecting a relatively younger age, which were not expected earlier. Whether it's type 2 diabetes mellitus, whether it's young heart attacks, also malignancies happening, not only because people are living long, but also happening at the younger age for a variety of reasons. I'm not going into that, because so that prevention is something that, because prevention of these diseases which could lead to debilitation or which could lead to target organ damage is not only per se an issue or a concern of the medical profession or the healthcare. It is actually amounts to not being able to put the nation's youth energy to optimum use. So if you have more and more youngsters succumbing to these ailments, and then also suffering from the complications happening thereof, we are actually not being able to use their energies which could have been otherwise used in the process of nation building or in the task of nation. So it's in the national interest now also for us to preserve the health and well-being and the optimum energy levels of our
Right, but I
youngsters.
think during the time of COVID, we all came together, the nation came together, and I think there were so many helping hands that time.
Yeah, because we were faced with the threat of death, everyone comes together. But that also has an important lesson that now we are entering into an era of integrated healthcare,
Right.
where the different streams of medicine, both the Western as well as the Oriental, have to come together to supplement each other's resources.
Right.
And COVID has been one of the success stories.
Absolutely, undoubtedly. All right, thank you so much sir, for
Thank
joining
you,
us
thank you
today.
very
It was
much.
lovely chatting with you.